Welcome to Ask Me Anything. Today I am here with our resident expert, Theresa Shepard, and we are going to talk a little bit about those really important words in dentistry. And Theresa, you have said that there are two very important words in dentistry. What are those words?
Well, most doctors would probably tell you those two most important words are pay me, but they really are prove it. So if you have a situation where you end up having to defend yourself for whatever reason, and it can happen, and it does happen to most people that think it will never happen to them. So you just have to be defensible. So the two most common words in dentistry should be prove it.
So you have lots of ways with your snapshot that you kind of dig into ways they're not proving it. Give some examples of what you often see in charting or in conversations that it probably really does come down to the documentation. Share a little bit more about some of the issues you see.
Well, it's not so much what I see often, it's what I don't see. And what I don't see is verification, and you can't prove clinical necessity. Why did we prep this crown? Well, because there was decay. All right, doesn't say that anywhere. What's the diagnosis? And so once we started prepping this crown, was the decay actually removed? So it seems like doctors especially or we're really in a hurry these days. We're stressed, we're short team members, and some doctors even have a rotating door. I know many practices that have had 6-7 people over the last year trying to fill the same spot.
Absolutely.
When that one person could have been there a couple years ago for 10 years. Mm-hmm. And so you kind of wonder, why is there a revolving door? Many times it's a lack of expectations and procedures and protocol, but that's a whole other topic.
Oh yeah, that's a conversation in itself.
Yeah, and so what I hear is, well, it's a new person that documented that, and we don't have time to train them. You don't have time to train them? That's a scary thing to say out loud, because if you don't have time to train them, when do you have time to do it over?
Right. Oh, that's such a great statement. If you don't have time to train them, when do you have time to do it over?
And often, because it is really the lack of narratives and documentation and proving clinical necessity and diagnosis that's not written down, I just hear that. Well, we don't have time to document. It takes too long. Everybody's staying late to document, and that shouldn't be. You really should be able to document when the patient is in the chair within a reasonable amount of time, if you have these policies and procedures in place and training protocol to do it. It's not that difficult, but it does seem insurmountable to the practice. I'm not dismissing that at all. I've sat in all those chairs. I get that. Mm-hmm. You look at something and it just seems mountainous, but we have to prove clinical necessity, because it's not a matter of, in many cases, if you're going to have to defend yourself, it's when you're going to have to defend yourself. And you may not have done anything wrong at all. You may have perfect feather margins. You may give the most painless injections. Your margins might be perfect. But if you can't back up what you did, you have no way to be defensible. And patients kind of know that these days. Mm-hmm. So you have to be able to defend yourself with every move you make.
Yeah, we kind of live in a time and space of sue happy kind of mentality. So it's probably never been more important to really cover your basis and have that documentation ready for the time when and if that happens. And like you said, probably will happen at some course in your point in your career, right?
Right. And I often will see little notes in a chart, like they weren't due for Xrays, so we didn't take any Xrays today. Well, what makes a patient due for Xrays? Only the doctor can determine that based on clinical necessity. But we get kind of stuck into this cycle of what is a patient's insurance benefit. Well, they're due for bite wings. They can have them once a year, perhaps. And so they're due this time. Well, again, who's ordering them, which is only the doctor, who's viewing them, which is only the doctor, and what's the diagnosis, and what's the reason that we need them at frequent intervals. And it's not to say that some patients don't need them very frequently, and other patients can go a little bit longer. So it has to be judged based on clinical necessity for the patient. I see very few practices that will actually document that the doctor ordered these X-rays and that they actually were viewed and what the actual diagnosis was. That's a rarity, but it's a necessity. So it's pretty easy to do. I mean, I can definitely help with templates and things like that. I have a love-hate relationship with templates. That's another thing that makes people not so defensible, is they're not filling out the templates. They're leaving too many blanks where they're prompted. So if something doesn't, like crown buildup, for example, might be a prompt. Well, if you didn't do it, take that prompt off, because it just looks like you didn't document anything.
Right.
So, and then
Leaving
sometimes things get charged out, right? And sometimes things get charged out, like crown buildup, when you really didn't do one. But the template reflects that, well, you could have, maybe you did.
Maybe.
So maybe not. Yeah. If I have any questions about a document that I read, you're not defensible.
Love it. Such great tips. As you stated, that's part of what Theresa does in her proprietary framework, the Snapshots Prevent Mugshots. Theresa's also going to be at our Synergy Leadership event on June 3rd. You can come and learn from her at that time. And we would just love to have you continue to follow us on all the cool things that we're doing. So we'll see you on the next AMA.